Hi, my name is Alex, and I'll be continuing my assessment of Mr. John Ruggiero by conducting an assessment of the chest and lungs. First thing I'm going to do is I'm going to assess my patient. I'm going to look at the shape, symmetry, and respiratory effort. So I'm looking at John, and the shape of the chest is normal. We got symmetry, and he doesn't look like he's having labored breathing. So I'm going to follow this up by identifying a couple of landmarks. I'm going to ask him to lift his chin. I'm going to look for the suprasternal notch, which is right here in between the left and right clavicle. Just below that, I can palpate the sternal angle, which marks the beginning of the second costal cartilages. All right, you can lower your chin. I'm also gonna assess thoracic expansion. I can do this by asking him to turn sideways for me for a second. Okay, I'm gonna place my hands on his back at the level of T10, and I'm gonna ask him to take a nice deep breath as I push inwards, and I'm gonna watch for the expansion of my thumbs. So the expansion was good. They were equal on both sides. Right. Now I'm going to assess tactile premises. I can do this by playing the ulnar aspect of my hands on his back, both sides, and I'm going to ask him to say 99 as I move over the locations over his back. So now I'm going to ask you to say 99.
99.
Okay.
99. Okay. 99.
Okay. So I felt it equal on both sides. You're looking for any differences between the sides. I'm also going to percuss the back. I'm going to do this by placing the middle finger of my hand, my non-dominant hand in his back, and I'm going to palpate with my dominant hand. Sounds good. Moving in a ladder-like motion, left to right, assessing side to side. Okay, sound the same on both sides. There's no dullness or anything. All right, John, you can go ahead and turn for me. All right, I'm going to do the same for percussion on the front. Alright, perfect. Now I can go ahead and assess breath sounds. I can do this by placing my diaphragm firmly on the chest and listening while he takes a deep breath. You want to listen to one full breath on each location as you auscultate. So John, I'm going to ask you to take one nice deep breath on each location, okay? Okay. Sounded equal. No crackles, no rhonchi. Everything sounded nice and clear. All right. So I'm going to do the same on the posterior aspect of his back. So if you just turn for me real quick. Okay, that sounded good. The next thing I can do while we're on the posterior side is do assess vocal resonance. The first part of this is to assess for egophony. Bronchophony. So you can do this by asking the patient to repeat 99 while auscultating across the lung fields. So John, I'm going to ask you to say 99 as I auscultate, okay?
Okay. 99. 99. 99. 99. 99. 99.
Okay. I can also check egophony, which is done by auscultating across the fields while the patient says E. Okay, so John, I'm going to ask you to say E as I auscultate across the fields, okay?
Okay. E. 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 E.
Okay. So I was able to hear something that was very muffled, indistinct. You couldn't really hear clearly what he was saying, which is what you're supposed to hear. All right. The last thing I'm going to do is I'm going to do a whispered test. So I'm going to ask you to whisper 1, 2, 3 as I auscultate. Could you whisper a little lower? Okay, perfect. So I wasn't really able to hear anything, which is a normal result. All right, well, that concludes the assessment of my chest and lungs, and I will see you on the next video.